Alrighty, everybody, I got cut off on my other video, but I'm back to continue that, and this is already an installment in the series we've been doing, Not Stopping Until You Learn Astrology. So with peace and love, I'd appreciate if you subscribe, like, and comment, share if you dare and care, and let's jump back into where we left off. So, we're talking about a progressed lunar ascendant, of course Martian, and it's at 29 degrees Scorpio, and it's conjunct the fixed star Antares, which is also 29 degrees Scorpio. So exact Antares, rival of Mars, so it's severe, potentially fatal illness. The native was hospitalized for 10 days. Now what's critical here is the progressed ascendant conjunct Antares is the signature of a life-threatening infection. Antares on Mars, the planet's namesake, is particularly potent. The native survived due to advanced Martian medical care. We have our decumbiture chart, which is, of course, Martian adapted. So the Martian ascendant we see is 8 degrees Leo. Sixth house cusp of illness is 28 degrees Scorpio. This is traditionally ruled by Mars, but modernly ruled by Pluto. And Mars at 22 degrees Pisces in the 8th house, Mars in the 8th house of Crises, sextile the 6th cusp, 22 degrees Pisces to 28 degrees Scorpio, 114 degrees, trine 120 degrees, orb 6 degrees. It's favorable. Part of breath, new Martian lot is the ascendant, adding Mercury, subtracting Saturn. So 8 Leo, adding 15 Gemini, subtracting 5 Taurus, 8 plus 15, 23, subtracting 5, 18 Gemini. And fixed star Algol, no aspect. So the infection was serious but not fatal, and this is our interpretation. The Antares conjunction on the progressed ascendant triggered the acute phase, and the favorable Mars 6th house trine in the decumbiture chart supported recovery. In our remedial recommendation for Martian colonists, pre-exposure prophylaxis, during Earth-Mars synodic periods when Earth transits the natal moon, and use of Martian herbal analogs grown in hydroponics, ruled by Mars and Virgo, Echinacea, licorice root. Alright, we're on to our 8th case study. So I said if you haven't seen my other video where we went through 1 through 7, and now we're going through 8 through 12. Alright, of our medical case studies. So our 8th case study is accidental poisoning, Amanita muscaria, mushroom toxicity. Alright, Amanita muscaria, whatever you want to say. So we have our birth date here, pseudonym, essentially our SP, our subject profile, right? Okay, our natal chart snapshot, which shows Sun 14 degrees Gemini, and it's in the 5th house. Moon is at 9 degrees Capricorn in the 12th house, and the ascendant is 2 degrees Scorpio. Mercury is at 25 degrees Gemini in the 5th house, opposite Neptune in the 9th degree of Sagittarius in the 1st house. Alright? A medical event is accidental ingestion of hallucinogenic mushrooms, misidentified, and our symptoms: confusion, tachycardia, mydriasis, and our confirmation is emergency room toxicology screen. Alright? So let's interpret this. Let's break this down with our AA and our NP, which go hand in hand. Alright? So, Mercury opposite Neptune, 16 degrees orb, 2 wide. Well, Mercury 25 degrees Gemini to Neptune 9 degrees Sag is 164, not opposition. Actually, 25 Gemini to 9 Sag is 164, so opposition would be 180. Orb 16, wide but still relevant for confusion of perception. Moon in Capricorn in the 12th house, vulnerable to hidden toxins, 12th house. And fixed stars at Betelgeuse at 28 degrees Gemini, conjunct natal Mercury, which is at 25 degrees Gemini, 3 degrees orb. Betelgeuse is associated with explosive, sudden poisoning. The star's name means armpit of the giant. not directly toxic, but in medieval astrology, it indicated danger from red substances. Amanita muscaria has a red cap. All right. And now we go over our EC, which is our event chart. We see August 20th, 2027, 22:15 PDT. We're going to go over our transit, position, aspect to natal orb interpretation. All right. So we see transiting Mercury, 28 degrees Virgo, and it's squaring the natal Neptune, which is 9 degrees Sag, but the orb is too wide as it's at 19 degrees. Right? Transiting Neptune, 27 Pisces, opposite natal Mercury, 25 Gemini, 2 degrees orb, separating. In Neptune opposite Mercury, confusion, hallucination, misidentification of reality. We have transiting Mars, which is 18 degrees Virgo, trining natal Sun, which is 14 degrees Gemini. So 4 degrees of an orb. It's acute physical response. Tachycardia, tachy, or if you will, the heart gets involved. Right? So transiting Uranus, 23 degrees Taurus, and it's square the natal ascendant, which is 2 degrees Scorpio. Now this orb is too wide because it's 21 degrees. Progressive Moon is 22 degrees Sag, conjunct the natal Neptune, which is 9 degrees Sag. It's 13 degrees of an orb, but it's applying emotional confusion and vulnerability to substances. So our critical transit, or our CT, is Neptune opposite the natal Mercury in its exact 2 degrees orb. So this is the classic signature for drug-induced confusion, misperception, and poisoning. Patient mistook Amanita for edible psilocybe. Right? And our decumbiture chart shows the ER arrival, 23:30 PDT, where ascendant was 22 degrees Gemini, and the 6th house cusp of illness, 28 degrees Scorpio, ruled by Mars. Mars at 18 Virgo, 4th house. Mars squared the 6th cusp, 18 Virgo to 28 Scorpio, 70 degrees sextile, 60 degrees orb, 10 degrees weak. All right, this is just what we call, in my opinion, astrology math. If you haven't seen my video on astrology math, I suggest you check that out with peace and love. So, our 12th house cusp, hidden danger, intoxication. We see 28 degrees Taurus taking place. It's ruled by Venus, and Venus is at 4 degrees Virgo in the 3rd house. So Venus square the 12th cusp, 4 Virgo to 28 Taurus, 84, not major. And part of poison, which is a new lot, ascendant, adding Neptune, subtracting Mercury, 22 Gemini, add 27 Pisces, subtract 25 Gemini. So basic math here, we get 24 Gemini. And fixed star algol is not conjunct. So we interpret this. The Neptune-Mercury opposition is the clearest indicator. The patient was treated with activated charcoal and discharged after 12 hours. No long-term damage. And we have our RR, remedial recommendation. Avoid foraging during Neptune hard aspects to personal planets. Carry a talisman of Jupiter ruling antidotes when collecting mushrooms. All right. Now I want to talk about elective surgery. Knee arthroscopy. All right. So, let us do just that. David P., or just David, January 15th, 1975, 10:22 EST in Denver, Colorado. Funny enough, check me out because I'm going to talk at After the Gender Experiment in Denver, Colorado, very soon, coming up on April 19th of this year. Saturn is in Aries, and I'll just give a quick side note. But I have Saturn natally in my 3rd house in Cancer. So this year, I'm going fucking crazy. I'm talking really long and really boldly in front of a lot of people about how shitty the United States is for allowing medicalization to happen to vulnerable people and surgeries, as well as the fact that I'm not a fan of my state, Minnesota. And except for the fact that I can get weed because I'm a medicinal marijuana patient and I'm just chilling for now. So, our natal chart snapshot: Sun 24 degrees Capricorn, 1st house, Moon 18 degrees Scorpio in the 11th house. Ascendant 15 degrees Capricorn, Saturn 14 degrees Cancer in the 7th house, opposite Mars 12 degrees Capricorn in the 1st house. And I'm going to talk of this after the gender experiment thing because I'm a detransitioner who shouldn't have even been on hormones in the first place that easily. Medical event: elective knee arthroscopy, meniscus repair, alright? And our outcome is uncomplicated. This individual has a full recovery. We're going to go over our AAA, but this time we're including our EE, which is our electional evaluation. So surgery was scheduled in advance, and we can assess whether the chosen time was optimal with our NP here, and then our EC. So, Saturn opposite Mars, 2 degrees orb, chronic joint issues. Saturn rules the bones, okay? Mars rules inflammation. The patient has suffered from knee pain for 10 years. Saturn opposite Mars. That is how important aspects are in astrology. Sun in Capricorn in the 1st house, strong constitution but prone to wear and tear injuries. We're talking about a sign that is a workaholic, you know. So, election chart here, our EC. So we have our factor position assessment. You see Moon at 10 degrees Gemini, and it's in the 7th house. So Moon in Gemini is ruling the lens. It's favorable. Moon trine Saturn, 14 degrees Libra, 4 degrees Orb. It's good for bone healing, all right? Venus, 22 degrees Taurus in the 11th house. Venus and Taurus ruling the knee. Taurus rules the cervical spine, not knee. But Venus rules the physical body's comfort, so it's favorable. Mars, 5 degrees Cancer, and it's in the 8th house. So Mars in the 8th house is surgical intervention, appropriate. And Mars sextiling Jupiter, 15 degrees Libra, it's 10 degrees Orb, it's weak. Saturn, 14 degrees Libra in the 2nd house, Saturn's retrograde, which is not ideal for elective bone surgery. But the Moon trine Saturn mitigates. See, the ascendant is 15 degrees Taurus, fixed earth sign, stable and good for surgery. 8th house cusp is 22 degrees Sag. Ruler is Jupiter at 15 degrees Libra in the 2nd house. So Jupiter square the ascendant. 15 Libra to 15 Taurus is 90. So exact square. Jupiter square the ascendant. Possible overconfidence, but not dangerous. Fixed stars Algol, 26 Taurus, conjunct ascendant, 15 Taurus to 26 Taurus, 11 degrees, not very tight at all. And Aldebaran, 9 Gemini, trine the ascendant, is favorable. Alrighty. So our overall election rating is 7 out of 10. Moon trine Saturn is excellent for bone healing, and the Jupiter square the ascendant is a minor flaw. Surgery succeeded without complication. So we have our post-operative follow-up. Lunar return chart for the month after surgery showed Moon in Scorpio in the 8th house. The patient reported swelling but no infection, and our remedial is Arnica, Montana, ruled by Mars, for bruising. Alrighty. We have our 10th case study, which is psychiatric as well. And this time it's treatment-resistant depression and ketamine therapy. So, I'll just look at the birth data. We don't really have to go over their name and whatnot, or else we'd be here way longer than we have to be. All right, and we have a lot to go through. So, Sun at 10 degrees Sag in the 7th house. What else? Moon, 29 degrees Leo in the 3rd house. Okay. And Ascendant, 28 degrees Scorpio. What does this tell us? Well, Saturn's also at 2 degrees Scorpio in the 12th house, and it's squaring Pluto at 27 degrees Libra in the 11th house. And our medical event is initiation of ketamine-assisted therapy for treatment-resistant depression. And the outcome, significant improvement after 6 sessions. All right, let's go over our important data here. Saturn in Scorpio, and it's in the 12th house, and it's squaring Pluto and Libra in the 11th house. Deep hidden depression, which is the 12th house, with power struggles, Pluto, and relationships, Libra. So the patient had failed 8 antidepressant trials. We see Moon and Leo in the 3rd house, it's dramatic emotional expression, but also vulnerability to ego wounds. And Sun and Sag in the 7th house is hopeful, philosophical, but the depression attacked the very capacity for hope. All right, and we see our fixed stars here. Antares, 9 degrees Sag, it's conjunct the natal Sun, 10 degrees Sag, it's 1 degree of an orb. All right, Antares brings obsession, intensity, and a dark night of the soul. The patient had suicidal ideation. Now we look at our therapy initiation chart. We have our electional intention here. The clinic chose a time when transiting Neptune, 22 degrees Pisces, was trine natal Saturn, 2 degrees Scorpio. The orb is too wide because it's 20 degrees. Actually, 22 degrees Pisces to 2 degrees Scorpio is 140 degrees. So, again, my bad. Trine, so 120 degrees orb, 20 degrees wide, but acceptable for Neptune's slow movement. And transiting Jupiter, 28 degrees Aries, trine natal Sun, 10 degrees Sag, 18 degrees orb, wide. We have a better aspect, which is transiting Venus, 28 degrees Pisces, sextiling natal Moon, 29 degrees Leo, which is 1 degrees orb, which is emotional comfort. So what's critical is transiting Pluto at 29 degrees Capricorn, squaring the natal Moon at 29 degrees Leo, which is an orb of 0 degrees. And this is a very intense transformative aspect. So Pluto square the Moon can bring up deep repressed emotions, exactly what ketamine therapy is designed to do. And the risk is psychological destabilization. The clinic monitored the patient closely. And the outcome is the patient reported a rebirth experience during the 3rd session. Pluto square Moon exact on that day. Depression remitted. Faculty notes that ketamine therapy should only be initiated under Pluto Moon hard aspects with medical supervision. And our remedial recommendation for psychiatric astrology. Screen for Antares conjunctions to personal planets. These patients are at high risk for suicidal ideation during depressive episodes. Schedule ketamine sessions during Pluto transits to the Moon or Mercury for deep psychological work, but only with emergency protocols in place. Alrighty, our second to last case study for medical astrology, and this little thingy we're doing here is Series Colony, Nutritional Deficiency, Scurvy. Alrighty, so coming to us from the Sirius Research Station, Vista, our pseudonym Lina M, was born June 17th, 2040, Series Meantime CMT. With a natal chart, Series Ephemeris, Vasilia Vena system. So Sun, 6 degrees Cancer, Series Zodiac adjusted for Series orbital plane. We see Moon is at 22 degrees Libra in the 5th house. Ascendant is 14 degrees Virgo. Venus is 18 degrees Taurus in the 9th, opposite Saturn, 20 degrees Scorpio in the 3rd house. All right. So the medical event is scurvy, vitamin C deficiency due to hydroponic crop failure. All right. In our clinical system confirmation, clinically affirmed confirmation, clinical signs, gingival bleeding and petechiae, low serum ascorbate. So we're going to go over our AA. This time, again, we have our considerations, but this time it's Cerebrian special, right? So Ceres has a diameter of 940 km, gravity 0.03 g, and a day length of 9 hours. The Cerebrian zodiac is defined by the dwarf planet's orbital plane. Inclination is 10.6 degrees to the ecliptic. In the faculty's Veslavina system, 2058 assigns rulerships. The series itself rules agriculture, food supply, and nutritional deficiency. All right? Things to keep in mind here. So, Sun in Cancer, 6 degrees, and Cancer rules the stomach and digestive system. On Ceres, where food is scarce, a Cancer sun indicates vulnerability to nutritional disorders. Venus opposite Saturn, 2 degrees orb. Venus rules the vascular system, capillaries. Affected in scurvy, Saturn restricts the opposition, suggests a chronic weakness in vitamin C metabolism. Fixed star is Ceres sky. From Ceres, Earth is a faint point near the sun, so it's not relevant. We have our event chart. So transiting Ceres, 18 degrees Aquarius, square natal Venus, 18 degrees Taurus, exact 90 degrees orb, 0 degrees Ceres square Venus, disruption of nutrition affecting the vascular system. Transiting Saturn, 22 degrees Scorpio, conjunct natal Saturn, 20 degrees Scorpio, 2 degrees orb, it's applying. Saturn returns second hit, restriction of resources, aging, deficiency. Transiting Mars, 4 degrees Virgo, opposite the natal Sun, 6 degrees Cancer, 2 degrees Orb, it's acute inflammatory response, gingivitis. Transiting Earth, 12 degrees Pisces, sextiling the natal Moon, 22 degrees Libra, 10 degrees Orb, it's wide. Earth is luminary, reminder of the home planet's abundant food, now absent. So what's critical here is the Ceres square Venus transit, which is exact. It's a signature for a breakdown of the food supply's effect on the body. The hydroponic failure Ceres directly caused the deficiency Venus. And we have our decumbiture chart here. So Ceres ascendant is 2 degrees Libra. 6th house cusp of illness is 18 degrees Aquarius, ruled by Uranus. Uranus at 12 degrees Gemini in the 9th house, but it's not strongly aspecting. Part of nutrition, which is a new lot, ascendant, adding Ceres, subtracting Venus. All right, so 2 Libra, add 18 Aquarius, subtract 18 Taurus. We get 2 degrees Libra, exact on the ascendant. It's a powerful indicator that the illness is directly caused by nutritional failure. And then fixed star algal, not in Ceres skies, obviously a different celestial sphere. We interpret that the Ceres square Venus transit is the primary cause. The patient was treated with vitamin C supplements and recovered within 2 weeks. For Cerebrian colonists, monitor transits of Ceres to Venus and Jupiter for food supply disruptions. Stockpile emergency supplements during Ceres Saturn hard aspects. Alrighty. Our final case study here is a terminal diagnosis of Alzheimer's disease, a longitudinal study. All right. So, Margaret W., born September 5th, 1935, 8:30 EST, Savannah, GA, USA. Sun, 12 degrees Virgo in the 6th house, already an indicator. Moon, 4 degrees Sagittarius in the 9th house. Ascendant is 22 degrees Scorpio. Mercury is 0 degrees Virgo, 5th house, and it is squaring Saturn, which is 4 degrees Pisces in the 11th house. Our medical event is a diagnosis of early onset Alzheimer's disease. Oh my god, maybe they're talking about me because I have issues with my brain. Who knows? Neurological exam, MMSE scores, and autopsy. Alrighty, long-term progression. This is our AA. So this case uses secondary progressions, solar arcs, and transits over a 13-year period. All right. Which, by the way, when we're talking about long-term progression in regards to medical astrology, we're talking about cancer or even like death forecasting. Whatever it is, in regards to like, medicine or, just medical astrology. What you want to do, God, my writing is going crazy. All right, what you want to do is always use secondary progressions, solar arcs, and if you can, make sure you are using long term, but also I guess short too, to look at stuff. But not just secondary progressions. Of course, you're gonna have to look at annual perfections. I have a lot of videos on a lot of stuff regarding astrology, so. Alrighty, so let's talk about Alzheimer's. Mercury squaring Saturn, 4 degrees orb. Cognitive restriction, alright, slow information processing, vulnerability to degenerative neurological conditions. We see Mercury is in Virgo, which is analytical, but it's squaring Saturn in Pisces, dissolving boundaries. The analytical mind gradually eroded by confusion. Sun is in Virgo in the 6th house, and the 6th house rules daily functioning. Alzheimer's attacks the ability to perform daily tasks. Fixed stars, Algol, no aspect, but Spica, 23 degrees Libra trine, natal Mercury, 0 degrees Virgo, wide orb of 23 degrees. And our key progressions, secondary progressed moon entered Pisces, squaring the natal Mercury in 1998, the beginning of mild cognitive decline. Secondary progressed sun conjunct the natal Saturn, 4 degrees Pisces in 2005, exact diagnosis, signature of a life-changing restriction, Saturn to the identity sun through neurological means, Pisces. And secondary progressed Mercury retrograded into Leo in 2000, not directly relevant. Alright, the transits at diagnosis. Transiting Pluto, 22 degrees Sag, squaring natal Mercury, 0 degrees Virgo. The orb is too wide because it's 22 degrees. Transiting Neptune, 13 degrees Aquarius, squaring natal Sun, 12 degrees Virgo, 1 degrees orb. And Neptune square Sun is confusion of identity and dissolution of the self. Transiting Saturn, 22 degrees Cancer, opposite natal Mercury, 0 degrees Virgo. Orb is again too wide for the same reason as up here. Transiting Uranus, 5 degrees Pisces, and conjunct natal Saturn, 4 degrees Pisces, 1 degrees orb. So Uranus on Saturn is sudden, shocking restriction. The diagnosis was a shock, all right? And our critical progression is progressed Sun conjunct the natal Saturn, being the strongest indicator. The patient lived 13 more years with steady decline, all right? And a death chart here. We see transiting Pluto. It's 19 degrees Capricorn, squaring natal moon, 4 degrees Sag. The orb is too wide, 15 degrees. Transiting Neptune, 14 degrees Pisces, conjunct natal Saturn, 4 degrees Pisces, 10 degrees orb. But Neptune was exactly conjunct the progressed Sun, which had moved to 17 degrees Pisces by 2018. Transiting Saturn, 5 degrees Capricorn, trine natal Mercury, 0 degrees Virgo, 5 degrees orb, a peaceful release. And of course, Algol was not involved. With a Neptune square Sun transit, a diagnosis initiated the dissolution. The final months had Neptune conjunct the progressed Sun, a gentle, dreamlike fading. All right. We have a remedial recommendation for families here. You can use lunar return charts to anticipate periods of agitation, moon and hard aspect to Mercury, and palliative astrology. All right. Schedule visits from loved ones during Venus or Jupiter transits to the natal moon for comfort. Now we're going to go over this appendix, which is just the medical lots and fixed star reference. So we went through a lot of lots that I came up with Personally, these are original. Lot formula, we have our medical significance here. All right, so we have a part of surgery, part of poison, part of death, part of madness, part of nutrition, and part of decompression. So I'm gonna just go ahead and come up with little like side names for these really quick. So POS, POP, POD, POM, PON, and PODC. Alright, so our POS shows us the ascendant adding Mars, subtracting Saturn, which is timing of elective procedures. Our PLP shows us ascendant adding Neptune, subtracting Mercury, susceptibility to toxic ingestion. Our POD shows us ascendant adding 8th cusp, subtracting Moon, life threat and acute illness. Our POM is ascendant adding Moon, subtracting Mercury, psychiatric hospitalization. Our PON is Ceres based, so ascendant adding Ceres, subtracting Venus, food related deficiencies. And our PODEC is lunar, ascendant adding Mars, subtracting Neptune, and pressure related illness. All right. So our fixed star degree, Tropical 2000 Medical Association, Algol, Antares, Betelgeuse, Regulus, Spica, and Sheet. All right. So Algol, 26 degrees Taurus, sudden death, decapitation, head trauma, severe psychosis. Antares, 9 degrees Sag, obsession, infection, near-death experiences. Betelgeuse, 28 degrees Gemini, is explosive conditions, poisoning, limb injury. Regulus is 29 degrees Leo, heart disease, pride-related illness. Spica is 23 degrees Libra, healing, fertility, nutritional abundance. And Sheath is 29 degrees Pisces, which is drowning, delusions, and imprisonment. So, these 12 case studies demonstrate the rigor and practical utility of medical astrology when applied with precise chart data, rectified times, and multiple technique validation. The faculty recommends 5 things here. Integration of decumbiture charts for acute events, emergency room admissions, symptom onset, use of planetary lots for specific diagnosis, part of poison, or PODEC, and fixed operons for severe outcomes, Algol, Antares, Betelgeuse, environment-specific ephemerized for Luna, Mars, and Ceres, ethical guidelines, medical astrology as adjunctive, not a replacement for evidence-based medicine. All recommendations must be made in consultation with licensed physicians for now. All right. Oh, not for that to happen like that. All right. There's another thing I wanted to go over. See if I can find. All right. Actually, I'll probably just make a follow-up video and go over some more stuff with you guys, and I'll see you there with peace and love. I need to go to bed. Piscean out.